Have you ever seen cases where there is a crack in the tooth, but you don't know if you can save those teeth or not? So I'm Dani Mancuso, specialist endodontist and prosthodontist, and I'm going to show it to you in our episode of the Diary of an Endodontist. So stay with me. It's quite common to receive cases like that, where there is a crack mainly on the distal of a molar, but we don't know if we can save it or not. The tooth is necrotic in this case. We took a CBCT. There is no bone loss. That's the first thing we do after checking the periodontal pocket. So we check the deep periodontal pocket, see if it's a narrow pocket in the 6 mark, and then we take a scan and see if there is any cervical bone loss in a vertical way. If there is, we know that that crack may be in that direction and perhaps we cannot save the tooth. In this case, we couldn't see it. We know that there is decay inside of the tooth, so it's quite discolored. The tooth doesn't respond to the endofrost. There is a little bit of mucosal thickness here, meaning that there is an inflammation apically as a result of a necrotic nerve. So what to do then? How to discuss that with your patient? So what we do here at the Specialist Endodontics Center is when the patient comes to us, whichever case, even if I cannot see any crack at all, I normally say that there is a risk that a tooth can be cracked under a filling, under a crown. So the way to do is, first of all, identify clinically and on the image. And if we cannot see anything that really compromises the tooth, then we say to the patient, we can offer you a root canal treatment. So if I access the tooth, I say to the patient, and the crack is beyond saving, is going deep into the root, is compromising the tooth structure, I know that that tooth is not going to be successful long term after the root canal treatment, then we will refer you back to your dentist to have the tooth removed, and we'll charge you 50% of the root canal treatment fee for the investigation. So that's normally what we say to the patient, because you have to anesthetize, you have to put the rubber down, you have to access, investigate, find the canals, open a little bit the canals to see where the crack goes to see if it goes too deep. So all of that will be probably half of your treatment anyway. So that's how we gauge. We say, we'll charge you 50% of the root canal treatment fee. If there is no crack, or there is a crack that is under control that can be stabilized with a crown, then we will carry on with the root canal treatment, do the root canal treatment, put a filling on top of that tooth nicely, try to remove the crack in full, and refer the patient back to have a crown done. It's important to have a crown. Every time there is a risk that tooth will fracture further because of occlusion, or because it's the last tooth, like this tooth doesn't have any tooth behind that, so it needs a crown. But the main thing when you explain to the patient is for that patient to understand that there is always a risk, because what the patients, they don't like is if you haven't discussed anything and you access the tooth, you spot a crack that you were not thinking about the existence of it, sometimes it's non-visible at all, and you have to say, I'm sorry, but your tooth needs to come out. So that anxiety plays up in the patient, and it's very difficult for the patient to understand that and to really trust on you again. So make sure you discuss everything beforehand, get your patient on board with the treatment, and if the patient is aware of the risk and still wants to go ahead with the treatment, then it's absolutely fine. You can go ahead and do your treatment. Hope you discuss a bit more with your patient. Hope it's easier for you to explain to the patient. And if you want me to give you more hints and advice on how to talk to your patient, please drop on the comments below. Let me know which kind of question you have and which kind of difficulties you have to talk to your patient, and I'll be happy to put on the next episode. And if you have a friend and found that very interesting, please share that with your friend, because that will help us grow our channel. Thank you very much, and you take care.